từng là giáo viên ở trường đại học Oxford ở Pháp và ông cũng đã từng đi giảng dạy ở rất là nhiều nước trên thế giới. Thì Emmanuel là một diễn giả rất là nổi tiếng về sinh sản và sinh lý cho thú non, thú sơ sinh. Thì ông đã từng làm việc với Royal Canin và ông hiện tại ông đang công tác ở Canada trong vòng 12 năm qua. Và không để quý anh chị chờ lâu nữa thì bây giờ chúng ta sẽ bắt đầu với cái buổi hội thảo ngày hôm nay về chủ đề parvovirus trên chó mèo. Vera. Buổi hội thảo sẽ có subtitle, sẽ có phụ đề bằng tiếng Việt, cho nên anh chị có thể theo dõi trên màn hình giúp em nhé.
Imagine being a new dog owner, delighted with a young, energetic puppy that suddenly falls severely ill. One day they're lively and active. The next, they're lethargic, refusing to eat, and showing clinical signs of a severe gastrointestinal disease. This is the stark reality of canine parvovirus infection, a disease we are all well too familiar with in veterinary medicine. It typically affects young dogs globally, and it is one of the leading causes of morbidity and mortality in puppies. The canine parvovirus is a single-stranded DNA virus. It affects rapidly dividing cells of the gastrointestinal tract, bone marrow, lymphoid tissue, and cardiac myocytes. And although its origin kind of remains a mystery, the virus shares a striking 98% of structural homology with the feline panleukopenia virus, suggesting an evolutionary jump from cats to dogs. Wild mammals may have also played a role in the virus's evolution, contributing to the advent of its various strains. And this is something I want you guys to remember right from the get-go. There is not one, but several canine parvoviruses actually. The minute virus, also known as CPV1, was first identified in the late 60s, causing both gastrointestinal and respiratory infections in dogs. In veterinary textbooks, it is still described as a cause of infertility and neonatal mortality in canines, although I must admit, this is very uncommon these days, in my experience at least. And a decade later, a mutation led to the emergence of a distinct variant, CPV2, triggering a pandemic outbreak affecting previously unexposed dogs. And this is the one that concerns us veterinarians these days. When we refer to parvovirus infection in dogs, it is this CPV2 we are talking about. But wait, it doesn't end here. Further genetic drift led to the advent of other variants, CPV2A, CPV2B, and more recently, CPV2C. Variants have spread globally, and they may present with different antigenic properties, which can pose a significant challenge for prevention and treatment actually. Wherever you are around the globe today, canine parvovirus is a threat for our canine patients, and understanding its insidious nature is crucial, I believe, because in order to provide effective care to our patients in our clinics and properly counseling the pet owners we see, this is key. As we delve into our discussion today, remember, our ultimate goal is to equip you with the knowledge and strategies to mitigate the impact of this devastating disease. So we will now embark on a journey during which we will answer 10 questions. 10 very practical questions I believe veterinarians should be very knowledgeable about in order to better address the challenges related to this disease. So let's dive right in and visualize the typical scenario of a canine parvovirus infection. Picture this. A puppy, anywhere from 1 to 6 months old, appears lethargic, loses appetite, and starts to exhibit distressing symptoms such as vomiting and diarrhea. This diarrhea, often hemorrhagic, can lead to severe dehydration, and although fever might be present, it's not a consistent feature here. And I want you to focus on one particular aspect, the smell. You may have heard some of our colleagues mention that this diarrhea smells like death. An almost distinctive and penetrating feature of this type of disorder. Okay, so let's put our understanding to the test. Here, I present to you 3 pictures of diarrhea. On this one, if I ask, could it be parvo? The answer is often a vibrant yes. However, what about this one? Doesn't really look like it, right? And this one? Definitely not, right? I myself would not suspect parvo at first sight if you were showing me those pictures. And yet, all 3 are from confirmed parvo cases. This brings us to our first key takeaway. Parvo is a chameleon, presenting in various guises. The severity and nature of diarrhea can vary from soft to mucoid, bloody or not. The animal's demeanor may also range from mildly lethargic to profoundly depressed. Therefore, anytime a puppy presents with diarrhea, regardless of its manifestation, parvo should be one of your primary differential diagnoses. And by the way, don't be misled by the ominous smell. It denotes severity and necrosis, yes, but it's not definitive for parvo. Even if the smell is present, you will still need to run some diagnostics to confirm it is indeed a parvo case. Because even when dealing with disorders like Giardia and Coccidia infections, which are in nature less severe, you could still end up dealing with the same necrotic smell. Now, consider this next scenario. A lethargic puppy with no overt gastrointestinal symptoms. Could this be parvo? Surprisingly, yes. There exists a myocardial form of canine parvovirus infection. This form, characterized by acute myocarditis, was commonly seen during the initial parvovirus epidemics, but it is currently perceived as a rarity. However, I assure you, it is still encountered. Always remember, parvo should be a suspicion when dealing with a lethargic puppy between 1 and 6 months of age. And now, let's extend our gaze to this adult dog, presented with mild diarrhea. Could this be parvo? Astonishingly, the answer, again, is it could be, yes. Parvo does not discriminate based on age. Subclinical infections, a vital consideration in kennels and animal shelters, can occur even in adults. While these dogs may not fall severely ill, they become virus shedders, potentially spreading the virus to more susceptible dogs. So you see, we've clearly established that parvo takes on many forms and faces. Always suspect it in puppies, and bear it in mind when dealing with adult dogs, especially those dogs living in communities like kennels and shelters. Your suspicion, however, should not be your endpoint. Suspecting parvo is only the beginning of our investigative journey. To confirm it, this suspicion must be followed by robust diagnostic tests. Let's journey further into our investigation of the canine parvovirus. Our next checkpoint is understanding the risk factors associated with this disorder. Why is it crucial to comprehend these elements? Because with a grasp of those risk factors, we can craft a better strategy and an effective game plan. Firstly, let's talk about breed predispositions. Certain breeds are known to have a heightened susceptibility to parvovirus. Rottweilers, Doberman Pinschers, and to broaden the spectrum, any black and tan dog seem to fall under this category in my experience. Toy breeds, while not necessarily more susceptible to contracting the disease, often suffer from severe forms due to dehydration's consequences. However, the paramount risk factor stems from the immune status of the dog, and this is not solely dependent on vaccination. The concept of the immunity gap explains why puppies are particularly susceptible, and it revolves around a key player, the mother's colostrum. Colostrum is really like an immunity elixir. It contains immunoglobulins for the disease the mother has encountered or been vaccinated against. And upon birth, puppies ingest the colostrum and the immunoglobulins it contains are absorbed in the digestive tract within the first 12 to 16 hours, peaking actually at 4 hours after birth. You already see that timing dramatically matters. Now, take a look at this graph and pay attention to those two distinct lines. The first represents the protection threshold, the minimum level of immunoglobulins needed to protect the puppy. The second line represents the vaccine neutralization threshold. Above this level, the maternal antibodies will neutralize the vaccine's antigens. The immunity gap is the period sandwiched between these two lines, typically occurring between 4 and 12 weeks after birth. During this gap, the puppy's antibodies are insufficient for protection, yet abundant enough to neutralize the administered vaccines. This variability can be attributed to factors such as amount and quality of the colostrum, the mother's vaccination status. And this period explains a common phenomenon. The puppies contract parvo shortly after vaccination. And it's not a vaccine failure per se. Instead, the vaccine was administered during this immunity gap, negating the remaining antibodies rather than stimulating the puppy's immune system. This occurrence is known as maternally derived antibody interference. And as veterinarians, it is crucial for us to be cognizant of this phenomenon. It's a key factor in vaccination failures in puppies, often leading to the onset of parvo. However, this challenge isn't insurmountable, and later in our discussion, we will explore the strategies to tackle this issue. Shifting our focus, we know that parvo primarily attacks rapidly dividing cells, especially those in the intestinal crypts, leading to the prevalent gastrointestinal symptoms. And the severity of these symptoms can actually be amplified when parvo is combined with other pathogens. For instance, canine coronavirus, which attacks cells at the top of the intestinal villi, when combined with parvo, can wreak havoc on the digestive epithelium. As you can see here, when you combine both pathogens, well, the digestive tract of the affected individual is severely messed up. Similar deadly combinations include parvo with circovirus, norovirus, giardia or coccidia. This highlights a crucial point for us as clinicians. Always be on the lookout for these additional pathogens when diagnosing parvo. Knowledge of such association can inform our prognosis and guide us in designing a more comprehensive treatment plan. For example, protozoa like giardia and coccidia would require specific treatments, so identifying them during the diagnostic process is vital. Remember, parvo comes in many forms and phases and is driven by several risk factors. Knowledge of these risk factors and a good understanding of the immunity gap can be our armor in our fight against parvo. Diagnosing canine parvovirus infection requires an intricate blend of clinical judgment, laboratory testing, and a comprehensive understanding of the disease's typical presentation. And remember what we said earlier, it should always start with a clinical suspicion. So you have this puppy or this adult dog actually in front of you, and you suspect it might be suffering from canine parvovirus infection. You now know that clinical suspicion is not enough, and you need to dig deeper to confirm your suspicion. First step, start with a fecal antigen test. These tests can be performed in-house, are cost-effective, and rapid to implement. Like all diagnostic tests though, be aware that they are not perfect. Although their specificity typically exceeds 90%, we cannot say the same of their sensitivity, which ranges from 16 to 80% depending on the studies that looked into these parameters. And this simply means that false negatives do occur, and they are not rare. They may be due to decreased or intermittent viral shedding in earlier or later stages of the infection, the binding of serum neutralizing antibodies with antigen in the intestinal lumen, or the dilution effect of the diarrhea as well. By the way, be aware that while anecdotal reports indicated that CPV2C infections may occur in the context of negative fecal tests, recent studies have shown that the sensitivity of those tests is not affected by the virus variant, which is a good thing, I guess. In the light of this evidence, in a dog with compatible clinical and clinico-pathologic abnormalities, a negative fecal antigen test does not rule out parvo, while a positive fecal antigen test, unless proven otherwise, should be interpreted as reflecting a natural infection. So the fecal antigen test is a good start. But in an ideal scenario, you should not stop there. When possible, I'd always recommend to go one step further. I'd always recommend to look at performing a digestive PCR panel. PCR-based methods, which detect viral DNA, are notably more sensitive and are particularly useful in cases where parvovirus is suspected, but in-clinic tests return negative results. PCR assays can even differentiate between parvovariants and discern between vaccine and field viruses. More important in my opinion though, digestive PCR panels can actually help you identify those associations of pathogens we mentioned earlier. And that can help to better define the right therapeutic treatment for a given case. PCR can also be very useful when dealing with cases of acute death. Again, this might not be of great interest for a pet owner, but they become very important if you work with dog breeders or with an animal shelter. In these cases, you want to confirm it was parvo indeed, so that you can take the right prophylactic measures to prevent the potential spread of the disease in those structures. In those cases, I typically perform a necropsy and collect samples of the different organs, especially the digestive tract and the heart. I will put half of them in formalin and send them for histology, and freeze the other half and send it for a PCR digestive panel. So you see, diagnosing parvo requires a multifaceted approach, blending clinical observation with those two main diagnostic tests. Each step is integral, and when used in combination, provides us with a robust toolset to accurately identify and deal with this severe infection. So, what happens once we encounter a puppy suspected of parvovirosis, presenting with positive fecal antigen test results while we're waiting for the definitive PCR results? The critical next steps focus on a deeper individual evaluation of the case, allowing us to gauge the severity of the disorder and fine-tune the prognosis for the concerned pet owner. One first port of call is to conduct blood tests. The crucial parameter here for me is the white blood cell count that we can obtain through a complete blood count. Leukopenia, a decrease in the number of white blood cells, is a common finding in cases of parvovirus infection. Parvovirus's destructive pathway primarily targets rapidly dividing cells, which unfortunately includes cells in the bone marrow, resulting in a diminished white blood cell count, often falling below 2,000–3,000 cells per microliter. The degree of leukopenia is widely acknowledged as a prognostic factor. Specifically, puppies with a white blood cell count falling below 1,000 cells per microliter generally carry a poor prognosis, and those are considered less likely to survive, to be honest. While this data was previously used almost as a diagnostic tool, its specificity leaves much to be desired. In my opinion, it should serve best as a supplementary source of information to refine your prognosis. For accurate diagnosis, your best allies remain PCR and fecal antigen tests. When feasible, I also recommend a full biochemistry panel to detect any underlying organic disorders. However, if I were to highlight the two most crucial parameters to examine, I would choose blood glucose levels and potassium levels. Hypokaliemia, or low potassium levels, is a common issue in parvovirus cases. This deficiency can lead to a myriad of complications, including weakness, ileus, and cardiac compromise. Therefore, potassium supplementation is a fundamental step in both maintaining normal kaliemia in healthy dogs and restoring potassium levels in hypokalemic cases. The detection of hypokaliemia thus warrants the inclusion of potassium supplementation in the treatment regimen. Hypoglycemia, or low blood sugar, may also occur, particularly in toy breeds. This possibility necessitates regular glucose measurements and, when needed, glucose supplementation in maintenance fluids. Hence, when examining a patient suspected of parvovirosis, having data on blood glucose and potassium levels at the beginning of the process is a vital step in establishing an effective treatment plan. In conclusion, you see, while awaiting for PCR results, it's crucial to perform individual case evaluations, including blood tests and, when possible again, a complete biochemistry panel. Pay particular attention to the white blood cell count, blood glucose, and potassium levels. The data gleaned from this test helps to fine-tune the prognosis, guide the treatment plan, and provide better care for our patients suffering from this disorder. Treatment for canine parvovirus primarily involves supportive and symptomatic measures to reduce mortality. While specific drugs to counteract canine parvo infection are yet to be identified, a multi-pronged therapeutic approach can help improve patient outcomes. The principal components of treatment include fluid therapy, antibiotic treatment, antiemetic treatment, and nutritional support. Fluid therapy plays a pivotal role in the treatment of this infection. And I believe when it comes to this, we can make this very complicated or very simple. At the end of the presentation, I will share with you references if you want to deep dive on this topic, because we could spend just hours on this aspect, I guess. Here, I will give you the very practical approach I used to refer to in clinics, which gave me good results for most of the cases. First, evaluate the degree of dehydration. I'm sure you are familiar with this type of table. Start there and use the data from the complete blood count, like the hematocrit, to be more accurate if you prefer. Then, calculate the amount of fluids the animal needs. You can use this formula here to calculate the volume of perfusion the animal should receive. And here is a tip to quickly evaluate the amount of fluid loss. Roughly estimate the optimal body weight of the pet and compare it to its actual weight. 1 gram of body weight equates to 1 milliliter of fluid loss. So use this to evaluate quickly the volume needed there. 3. Achieve vascular access. Given the high risk of contamination of a catheter with vomit and feces, these days, jugular catheter placement is preferred. It allows not only the administration of IV fluids, but also enables blood sample collection for regular monitoring of glucose, acid base, and electrolyte levels. I must admit that back in the days, I'd typically go for a peripheral vein catheterization, typically on the front legs. If you do so today, be aware that it is recommended that the catheters should be replaced every 72 hours to minimize bacterial colonization. In hypovolemic patients, intraosseous access, like what we do in critical care for neonates, can be considered. They are quicker and equally successful as jugular catheter placement, actually. I must admit I am not a big fan on my hand. The sound it makes when inserting the catheter always makes me cringe, and there are associated risks of osteomyelitis. But to be fair, sometimes this is the only solution we have. So in last resort, do not hesitate to use them. And 4. Administer fluids then. An isotonic crystalloid solution, like lactated ringers, is the fluid of choice for initial volume restoration and rehydration. This is typically how it should be used in clinic. As mentioned earlier, if hypokaliemia and hypoglycemia were confirmed in the patient, supplement the fluid accordingly to correct these deficits as well. The administration of antiemetics in conjunction with flood therapy and enteral nutrition plays a pivotal role in managing canine parvovirus infection. Research on antiemetic use in puppies with parvo demonstrates that those who did not receive antiemetics had actually an increased length of hospital stay. This finding underscores the importance of integrating antiemetics into the treatment regimen, as this approach could potentially lead to faster recovery times and shorter hospital stays. So you definitely want to make sure you integrate them in your treatment protocol as early as possible. Here are the different antiemetics that are typically described in the veterinary scientific literature these days. Be aware that they do have different modes of actions, and maropitant, for instance, seems to be superior in this regard. However, comparative studies have showed no significant difference among these drugs in reducing vomiting episodes in parvo cases. Side note, drugs like metoclopramide can be administered as a bolus or as a constant rate infusion to dogs with severe vomiting, which is something that is worth considering in certain cases, in my opinion. Canine parvovirus enteritis put dogs at a high risk for bacterial translocation due to intestinal villus collapse and the loss of immune function. This translocation can lead to sepsis caused by a variety of bacteria, including Escherichia coli, Clostridium difficile, and Salmonella. In response to this risk, the administration of broad-spectrum antibiotics is recommended for all dogs affected by canine parvovirus. And these are the antibiotics that are typically recommended in those cases. Ampicillin and cefoxitin, as single-agent treatments or in combination with enrofloxacin, offer protection against gram-positive, gram-negative, and anaerobic organisms, and are therefore considered rational empirical choices. And as mentioned earlier, comorbidities, including gastrointestinal parasitism, are often present in puppies with parvo. Therefore, initiation of antiparasite therapy as soon as the puppy can tolerate oral therapies is also something to keep in mind, especially if you confirm that an association of pathogens is present. Enteral nutrition is also a critical component of the treatment regimen for dogs suffering from canine parvovirus infection. It is indeed necessary to prevent enterocyte atrophy and provide the nutrients required for healing. In the past, we used to practice the nil peros feeding strategy in those cases. Do not feed them anything peros for 24 to 48 hours. That's what I was taught back in the day. We know better today. Early provision of enteral nutrition in puppies with parvo enteritis has actually been found to decrease patient morbidity and length of hospital stay. Enteral feeding has indeed been associated with improved mucosal integrity, faster repair, and reduced bacterial translocation. So we can calculate the daily energy needs of these puppies, and a nasogastric tube can be used to deliver this nutrition, preventing abdominal discomfort and vomiting or regurgitation. We now even have liquid diets that can help, and their use and benefits have been described for parvo cases. So clearly something to consider as soon as possible these days. Canine parvovirus infection often results in significant discomfort for affected dogs. Consequently, managing the pain experienced by these patients is a crucial aspect of their overall treatment. It is important to understand, however, that not all forms of analgesia are suitable due to the potential for additional complications. Typically, opioid analgesics are used to alleviate pain, but their administration in parvo-infected patients can actually exacerbate symptoms by promoting ileus and vomiting. As such, alternative analgesics like buprenorphine or butorphanol are often preferred over pure mu agonists such as methadone, morphine, hydromorphone, or fentanyl. The incorporation of lidocaine, a well-known local anesthetic, at a continuous rate infusion can also promote gastrointestinal motility and provide analgesia. This is also an argument in favor of the use of maropitant, as this antiemetic also provides visceral analgesia. And something to keep in mind, in cases of parvo, it is equally crucial to avoid certain analgesics that can exacerbate the condition. Alpha-2 agonists and non-steroidal anti-inflammatory drugs, for example, are contraindicated. The former can cause extreme vasoconstriction and limit gastrointestinal perfusion, while the latter can impair gastrointestinal and renal perfusion, both of which can further complicate the treatment. And there is certainly more coming in the future in the area of medical treatment. The promise of recombinant feline interferon omega has been demonstrated in reducing clinical signs and mortality, but its high cost and limited availability hamper its regular inclusion in treatment regimens. Early enteral administration of parvo antibodies has shown efficacy in reducing clinical signs in puppies, indicating that early intervention could be a key factor in treatment success. Granulocyte colony stimulating factor has been considered for its ability to improve neutrophil counts. Transplantation or fecal transplants from a healthy host has shown promising results, including earlier resolution of diarrhea, decreased hospitalization, and improved survival. So you see, there might be change on the horizon, which will give us even more tools, efficient tools moreover, to better address those critical situations. Canine parvovirus infection is highly contagious and potentially lethal in dogs. Based on what we just discussed, I am sure there is no doubt in your mind. It necessitates urgent treatment. And the best way to administer it is through hospitalization. However, hospitalization and treatment costs often serve as a significant barrier for many pet owners. Acknowledging these limitations, recent research has focused on cost-effective outpatient, which basically means treating patients from home. And those have shown a promising survival rate of 75 to 80%, almost similar to what we observe with hospitalization. The common denominators in these outpatient strategies are the imperative need for hydration through subcutaneous fluids, the use of antiemetic medication, and the critical role of enteral nutrition. One such prospective study recommends a sequenced approach, beginning with the placement of an intravenous catheter, followed by administering IV crystalloid fluids until the dog's perfusion parameters are normalized. Any present hypoglycemia is addressed by using IV dextrose, and once the hydration status is stabilized, the puppies are then treated with a dose of cefovexin, maropitant, and buprenorphine, a partial opioid agonist for pain relief. This outpatient treatment plan also includes high fructose corn syrup, a commercially available diet, oral potassium supplementation, and subcutaneous fluids. So the viability of this outpatient strategy leans heavily on the commitment and participation of dedicated pet owners who, due to financial constraints, may be unable to afford inpatient therapy. With proper instruction on how to administer subcutaneous fluids and other medications at home, there is a moderately good chance of success for the treatment of parvo infection. This development is obviously welcomed in the field of veterinary medicine. But it's important to emphasize that while this outpatient strategy has shown promising results, might not be suitable for all cases. The condition of the patient, the extent of the disease, and the capability of the owner to administer the prescribed treatment at home are all vital factors to consider. The option exists though, and it is now described in the veterinary scientific literature. So I guess it's certainly worth considering in certain situations. We haven't talked yet much about vaccination, and yet this is a cornerstone of the medical prophylaxis against this disorder. The Vaccination Guidelines Group of the World Small Animal Veterinary Association recognize parvo vaccines as core vaccines, meaning they should be administered to all dogs regardless of their circumstances or location due to the severe life-threatening nature of the disease. And a minimum vaccination coverage of 70 to 75% has been suggested previously to be adequate to prevent disease outbreaks in own dog populations. The role of vaccination in controlling the spread of canine parvo infection in dogs and preventing the development of the disease is paramount. Nevertheless, the efficacy of these vaccines is conditional on strategic and timely administration and strict adherence to the recommendation regarding vaccination schedule. The vaccination process should always be customized, taking into account several individual factors such as the dog's age, breed, lifestyle, as well as the disease prevalence in the particular geographical area. It's important to note that a one-size-fits-all approach may not effectively cover all scenarios. Thus, the need for flexible yet robust vaccination protocols. Primarily, modified live virus vaccines form the cornerstone of such protocols. In a typical pet-owning household, the primary vaccination series for parvo is initiated when puppies are between 6 to 8 weeks old, with some vaccines licensed for administration as early as 4 weeks after birth. Following the initial shot, a revaccination at intervals of 2 to 4 weeks is advised until the dog reaches 16 weeks. However, in high-risk environment with a high prevalence of canine parvo, the last vaccination may be delayed to 20 weeks after birth. For dogs older than 16 weeks, a single dose of the vaccine is generally considered sufficient, as the maternal antibodies no longer interfere with the vaccination response at this stage. Although, administering 2 doses 2 to 4 weeks apart is also an accepted practice. Dogs should then receive a booster within a year after completing the primary vaccination course, and subsequent boosters at interval of 3 years or longer. I encourage you to take a look at the WSAVA guidelines. They are regularly updated and will provide you with much more details on the matter. Side note, in shelter environments, where the burden of the virus can be high due to the housing of dogs with unknown vaccination and hygiene statuses and high population turnover, a more intensive vaccination program is always recommended. Have a look at the guidelines I previously mentioned. You will see that there is a section specifically dedicated for this type of structures. I mentioned it earlier, and as promised, let's focus on this important aspect. Indeed, remember, the most frequent reason for vaccination failure is because of the interference of maternally derived antibodies from the colostrum of the mother, as explained earlier. And different strategies have been proposed to overcome this phenomenon. One is determination of those maternally derived antibody titers. MDA titration at 4 to 6 weeks of age can be useful to predict the best time to vaccinate pups, taking into account the curve of MDA decline, which is based on the MDA half-life. For instance, if a pup displays an antibody titer of 1 to 640 at 4 weeks of age, considering an MDA medium half-life of 10 days, the optimal period for vaccination could be estimated approximately at 10-11 weeks, when MDA will presumably drop below titers of 1/420 to 1/240. This approach has its merits, but it can be cumbersome, requiring serum collection and delivery to a specialized laboratory. In-clinic tests are being developed and could help to democratize this strategy in the future. High-titer vaccines can be used as well. These vaccines have the advantage of containing viral titers 2-3 logs higher than those of traditional vaccines, such that in the presence of intermediate MDA titers, not all viral particles are neutralized, and they are able to induce an active immune response. To this end, current vaccination guidelines recommend initiating a series of high-titer modified live vaccinations at 6 weeks of age, to be repeated every 3 to 4 weeks until the puppy is 16 weeks old. For puppies with a higher risk of exposure, like those in shelters, starting vaccinations as early as 4 weeks and continuing until 18 to 20 weeks may be advised there. Last, alternative routes of vaccine administration are also being discussed. Administering parvo vaccines via alternative routes to the parenteral one may help limiting vaccine virus neutralization by the MDA. Experimental vaccines have been administered intranasally and are proven to partially overcome MDA interference. More recently, the oral administration of a commercially available parvo monovalent vaccine was also proven to be effective in overcoming the MDA interference. However, no commercially available parvo vaccine is currently registered for oral administration, so that administration via alternative routes to the parental is considered off-label. In addition, according to the WSAVA vaccination guidelines, these alternative routes of parvo vaccinations are not as effective as parenteral, like subcutaneous or intramuscular. In my opinion, high-titer vaccines remain the best course of action as of today. And here again, we'll see what the future brings us, because there is certainly more to come on this, in my opinion. Parvovirus is primarily transmitted via oronasal contact with infected material, such as vomit or feces. However, it is important to remember that it is a potent and resilient adversary. It can indeed survive for over a year in harsh environmental conditions. Due to its environmental tenacity, preventing its spread necessitates particular attention to sanitation, especially within our clinics. To begin with, isolation is paramount. In case a dog suffering from parvo needs to be hospitalized in your facility, ensure that an isolation ward is available for infectious cases. And never mix parvo-infected animals with other species. Remember that CPV2C can spread between dogs and cats. Thus, it is crucial not to house different species together in our hospitalization rooms. I think this is a very important reminder here. One key transmission route to consider is through hands and shoes. Wearing personal protective equipment is essential when treating and handling a parvo case. Donning single-use gloves, a coverall, and shoe covers can significantly minimize transmission risks. This protective equipment should remain within the confines of the isolation room and should not migrate into other clinic areas, obviously. And moreover, the importance of a proper sanitation protocol within your clinic cannot be overstated. The sanitation process is twofold. First, clean, which entails removing organic matter using an effective soap. And then, disinfect, using an appropriate disinfectant. I think it's very important to note that not all disinfectants are created equal when it comes to tackling parvo. The ideal options for veterinary clinics, in my opinion, are diluted bleach, potassium peroxymonosulfate, and a game changer in disinfection technology, accelerated hydrogen peroxides, or AHPs. For tackling parvo using bleach, you'd want to use a 5% bleach solution, diluted at a 1 to 32 ratio. And proper usage of these products is as important as choosing the right one, actually. Both bleach and potassium peroxymonosulfate require a sitting time of 10 minutes before rinsing to be effective. If you don't adhere to this wait time, the disinfection process may prove useless, actually. AHPs, on the other hand, are superior in terms of required contact time, which is around 1 minute, and they don't require rinsing after use. This considerably increases compliance with sanitation protocols, making AHPs an attractive alternative in the long run. And these are the essential elements you need to bear in mind when managing parvo cases. If you collaborate with animal shelters and dog breeders, sharing these concepts with them is paramount. Another important element you need to share with them. The incubation period following natural or experimental exposure ranges from 4 to 14 days. This means that all animals that have been in contact with an infected individual should be quarantined and considered suspects until the end of this period. Affected animals can shed the virus up to 3 to 4 weeks, maybe more, post-exposure. This means that caution should be taken when they are reintegrating the kennel or the shelter. And once again, they should remain isolated and not in contact with susceptible individuals. You see, this collective effort can significantly aid in preventing the spread of the disease within their facilities. Remember, puppies typically develop parvo between 1 and 6 months of age. And it is critical to remember that this phase is extremely formative, with any event occurring during this one having the potential to produce lifelong impacts. Parvovirosis is indeed a severe disorder, and puppies affected by it will inevitably experience stunted growth afterwards. Veterinary medicine has made leaps and strides in addressing this issue with the introduction of canine pediatric growth charts. Modeled after the same statistical principles used in human medicine, these charts are instrumental in monitoring a puppy's progress. There are 10 growth charts for dogs, each catering to different estimated adult body weight and genders. A puppy's normal growth trajectory should align with the central lines shown on these charts. However, the onset of a disease like parvo reflects a significant slowdown on these growth trajectories. A puppy may begin to grow again after surviving the ordeal, but it may never regain the original growth trajectory due to the severity of the disorder. So given the importance of this pediatric phase, which goes again from the end of nutritional weaning to the time those puppies attain their adult size, it is highly recommended to use these pediatric growth charts. They are game changers in monitoring the growth and progress of puppies, in my opinion. With these charts, you can determine if puppies are catching up and getting back on track as swiftly as possible. And if not, you can visualize it and decide on the appropriate measures. Furthermore, it is important to note that studies have revealed that puppies which have weathered parvo are more susceptible to chronic gastrointestinal disorders later in life, such as inflammatory bowel disease, for instance. Therefore, monitoring is essential for these puppies, and their nutrition needs to be optimized to provide additional digestive support. Their diet should be highly digestible and contain nutrients beneficial for the digestive tract, including prebiotics, beta-glucans, and omega-3 fatty acids, for instance. The diet's ability to support digestion is an integral consideration for puppies that have survived parvo. So you see, the consequences of events during puppyhood can ripple throughout a dog's lifetime. If a puppy has been through the trials of parvo, remember that our job as veterinarians extends beyond the initial recovery phase. The owner should be made aware of the necessary follow-up measures to optimize the puppy's health even further. And I believe we must do everything in our power to ensure that these puppies grow up healthy despite the setbacks they have faced. As we reach the end, I'd like to encapsulate the essence of our discussion in 3 salient points. First, effective medical treatment for parvovirus infection can bolster a puppy's survival rate to around 80%. Without treatment, the prognosis is dire. Hence, as veterinary professional, here is your aspirational benchmark, right there. Secondly, prevention, primarily through vaccination, is indispensable. As a veterinary community, we must strive to educate our clients about its critical importance. Herd immunity, a crucial line of defense against parvo, can be achieved when we have a 75% vaccination rate among dogs, We must aim for this target. Third, post-recovery monitoring of puppies that have survived parvo is critical. Attention to stunt growth and potential chronic GI disorders ensures not just survival, but improved quality of life on the long run. It is crucial to remind ourselves and pet owners that when the puppy leaves the clinic, the battle does not end. Parvovirus infection is an enduring challenge in the canine world. It is unlikely to disappear anytime soon. That's my guess. Our task as veterinarians is to stay prepared and updated, as this field is ripe for advancements. Innovations such as new vaccination delivery methods, the increasing use of interferon omega, and fecal transplantation all hint at exciting changes on the horizon. In essence, ours is a field marked by constant learning, change, and adaptation. As you depart from this talk today, remember that this overview merely scratches the surface of the intricate world of parvo management. To delve deeper, I encourage you to scan this QR code, which will guide you to all the studies I referenced during this presentation. Now guys, armed with the knowledge I shared today, I hope that you are better equipped to address those 10 essential questions I believe every veterinarian should be knowledgeable about when facing cases of canine parvovirus infection. It is now on you to internalize this knowledge and use it in the field to make a tangible difference. Yep, you've heard the knowledge. Now it is your time to leverage it and use it to lead the change.
Dạ vâng, phần trình bày của tiến sĩ Emmanuel vừa kết thúc thì tiếp đến đây sẽ là phần Q&A của cái buổi hội thảo hôm nay. Thì các anh chị nếu có câu hỏi thắc mắc vui lòng gửi câu hỏi vào trong cái mục Q&A ở phía dưới cuối của cái màn hình để mà có thể gửi đến câu hỏi cho tiến sĩ Emmanuel. Rồi bây giờ chúng ta có rất là nhiều câu hỏi ở đây. Khi nào chúng ta sẽ bắt đầu. Hiện giờ thì hội thảo đang chia thành hai kênh là kênh tiếng Việt và kênh tiếng Anh. Các anh chị vui lòng chọn kênh tiếng Việt nếu như mà mình muốn nghe tiếng Việt được dịch thuật từ bác sĩ Nam An ạ. Rồi. Vâng, so thank you very much Dr. Emmanuel Fontaine. So now we have a lot of questions for the topic today. So we still have two questions that the participants, they gave the questions in the previous webinar. That's the questions about the parvovirus. So the first question is, what kind of food considered is good for the dogs had parvovirus disease?
Okay, so when it comes to feeding a dog during that is suffering from parvo, as we mentioned in the presentation, it is very important to reinstall this feeding as quickly as possible. I think that's really the key message, because in the past, I know when I was at the vet school, we were told, oh, don't feed them for 24, 48 hours and then start feeding them. When it comes to the food you want to feed those puppies that are suffering, ideally, you would go for a liquid diet, like a liquid recovery diet, which might or might not be available depending on the country. That would be the best option, in my opinion. Of course, many people are going to tell you, but those are not meant for puppies. It will not cover the growth needs of the puppies, but it will provide them with the energy. So that's really what you want to provide them with. Instead of giving you a full answer, I have a better answer, actually. There's a guide on critical nutrition, on nutrition for critically ill patients that is available. And that would be my best reference, because in this guide, you will find all the answers that would apply to those specific situations.
Okay. Okay, thank you. So the next question is, if the dog has parvovirus and tick and bone disease, such as ehrlichiosis and kidney failure at the same time. So how could we do the treatment? How can we prescribe for that dog?
So your treatment needs to be sequential. First, you focus on stabilizing the dog. That's the primary concern. That should be your primary concern. And just go through all the steps we mentioned in the presentation, and you stabilize the dog. When it is stabilized, and as we mentioned, this is when they are stabilized, this is when you can consider additional treatment for those specific diseases you mentioned. But first, you want to stabilize them. Then go for the treatment for ehrlichiosis, etc. But first, that's the key. Don't overthink it. Don't try to approach all things at the same time. First stabilize, then give the additional treatments.
Okay, thank you. So the next questions. If the anti-vomit medication is not effective, so what could we prescribe more for the animals?
So that's something actually you will encounter in clinics. Some dogs are unfortunately refractory to the antiemetic treatment, or at least they're not refractory, but they do not respond well to the treatment. And that's usually, that will affect, obviously, your prognosis. So the way I approach it, the first thing I would do is I would try a different molecule. The 3 molecules I showed you, metoclopramide.
Cái loại thuốc đầu tiên mình có là metoclopramide nè, mình có ondansetron và mình có maropitant. Lý tưởng nhất là nếu như mà nó có thể có thì chúng ta sẽ sử dụng maropitant. Thì đây là một cái loại thuốc chống nôn rất là tốt. Đây là cái lựa chọn đầu tiên của tôi. Nếu như mà cái loại thuốc đầu tiên này mà không có hiệu quả tốt thì sau đó bạn mới sử dụng cái lựa chọn thứ hai. Cái cách thứ hai đó là bạn vẫn sẽ sử dụng ví dụ như là metoclopramide, nhưng mà bạn sẽ cho vào dịch truyền và truyền cái tốc độ chậm để mà mình có thể cung cấp thuốc ở cái thời gian dài hơn, để duy trì được cái hiệu quả của cái tác nhân chống ói. Trong trường hợp là con chó con nó quá nhỏ và mình sẽ không thể nào đặt dịch truyền tĩnh mạch được, thì mình sẽ có những cái liệu pháp khác để mà mình có thể thay thế cho cái liệu pháp truyền dịch tĩnh mạch hay không. Đầu tiên là tôi nghĩ là bạn có thể cố gắng bạn đặt ở cái tĩnh mạch cổ. Thường hồi xưa là tôi hay đặt tĩnh mạch ở đến tĩnh mạch chân, tuy nhiên vì tôi nghĩ là hồi xưa đó là nó dễ nhất. Nhưng mà đa phần ở thời điểm hiện tại là tôi thấy là họ hay đi đến sử dụng cái tĩnh mạch cổ. Khi mà bạn đã quen với lại những cái kỹ thuật này rồi á, thì mình sẽ đặt cái tĩnh mạch cổ rất là dễ. Đây sẽ như hồi nãy tôi có đề cập ở trong bài, đó là chúng ta sẽ sử dụng dịch truyền dưới da. Truyền dịch dưới da không phải là cái liệu pháp tốt nhất, tuy nhiên là nó cái liệu pháp mà có thể thay thế được cho những cái liệu pháp thông thường, đó là truyền dịch tĩnh mạch. Tôi không có thích truyền dịch thông qua màng bụng, tại vì khi mà bạn đâm qua màng bụng như vậy, bạn rất là dễ bị đâm lộn vào trong những cái nội quan ở bên trong ruột trong bụng, và nó sẽ rất là có nguy cơ bị nhiễm trùng huyết. Nên là đầu tiên là tôi sẽ luôn ưu tiên tĩnh mạch cổ trước. Nếu như mà tĩnh mạch cổ không được thì sau đó tôi sẽ thay thế bằng dịch dưới da. Dạ, câu hỏi tiếp theo. Câu hỏi đây là khi nào mình nên cho chó ăn trong cái quá trình bị bệnh parvo, nó nên là bước đầu, bước sau hay là bước cuối? Chúng ta có thể sử dụng những cái loại thức ăn như là cháo, loãng rồi này để cho nó có thể ăn hay không? Câu trả lời cho cái khi nào đó là càng sớm càng tốt. Vì như chúng ta đã nói đó, ngày xưa á, chúng ta luôn luôn có một cái tư tưởng là không bao giờ được cho nó ăn. Tuy nhiên á, là hiện nay á, là nếu như mà các bạn không cho con chó nó ăn thì nó sẽ không có nhận được cái lượng năng lượng mà nó cần. Về cái giải pháp á, mà tôi luôn luôn nghĩ tới đó là cái loại thức ăn dạng lỏng. Tại vì bạn có thể sử dụng cái ống thông dạ dày thực quản để mà bạn cung cấp cái lượng thức ăn đó trực tiếp vào trong dạ dày luôn, và nó sẽ hấp thu rất là nhanh. Khi mà nói đến những thức ăn như là cháo hoặc là thịt gà đó, cái yếu tố bạn cần lưu ý tới á, là khi mà bạn cung cấp cho những con chó này, đó là bạn sẽ cần cung cấp cho nó năng lượng. Với cháo hoặc là cơm á, thì tôi không nghĩ là nó có quá nhiều cái lượng năng lượng, hoặc là nó sẽ không cung cấp được đủ cái năng lượng cho con chó nó cần, và tôi cũng sẽ không, cái đó không phải là cái lựa chọn đầu tiên. Đối với lại các ờ, một số phòng mạch thì họ có sử dụng cái siro từ ngô, thì đây cũng là một cái giải pháp. Tuy nhiên á, là cháo với lại hoặc là cơm thì không phải là cái lựa chọn đầu tiên mà tôi sẽ đi sử dụng. Ờ, thì ờ, câu hỏi cuối cùng đó là nếu như mà đối với một con chó mà nó đã bị nhiễm parvo thì khi nào chúng ta sẽ tiêm vaccine lại cho nó được? Bây giờ bạn hãy nghĩ về nó nhé. Nếu như một con chó con hoặc mèo con nó đã cải thiện xong rồi, thì chúng sẽ sản sinh ra một cái lượng kháng thể rất là cao, nên chúng sẽ có cái hiệu giá kháng thể bên trong cơ thể rất là cao, cho lên đến 20 tháng sau khi mà hồi phục. Bạn biết là nó sẽ hồi phục rồi, nó sẽ không cần, bạn sẽ nghĩ là không cần tiêm vaccine nữa hay đúng không? Cái câu trả lời đây là bạn nên làm cái kiểm tra hiệu giá kháng thể của huyết thanh, và sau khi đó dựa vào cái kết quả của cái hiệu giá kháng thể đó mà bạn có thể quyết định được xem là có tiêm hay là không. Nhưng mà bạn nên lưu ý đó là khi mà bạn tiêm vaccine đó, bạn không chỉ tiêm vaccine ngừa với bệnh parvo, mà bạn sẽ còn tiêm vaccine rất là nhiều những cái loại bệnh khác. Cho nên là khi mà mình tiêm vaccine như vậy á, thì đối với theo cái ý kiến của tôi đó là ờ, và cái việc là bạn muốn tất cả những cái khả năng che phủ vaccine của trên toàn cộng đồng là 75% á, thì đối với một con chó mà nó đã hoàn thành, nó hồi phục rồi á, và nó bắt đầu nó tăng trưởng trở lại bình thường rồi, và khi mà bạn bắt đầu bạn thấy con chó nó đã hoàn toàn hồi phục, nó tăng trưởng trở lại bình thường, thì khi đó bạn bắt đầu bạn vaccine trở lại, và nhưng nhớ là bạn sẽ luôn luôn bạn vaccine không chỉ cho parvo mà còn có những cái tác nhân khác mà bạn sẽ cần phải vaccine chung với parvo nữa. Dạ, rất là cảm ơn câu trả lời rất là rõ ràng của bác sĩ Emmanuel. Bây giờ chúng ta sẽ kết thúc cái bài hội thảo ngày hôm nay. À, những cái câu hỏi mà chưa được trả lời thì chúng tôi sẽ à, à, tổng hợp và gửi lại cho quý anh chị sau. Xin rất là cảm ơn tất cả các anh chị. Anh chị anh chị có thể dùng anh chị nhớ đừng quên là mình sẽ có một cái buổi khảo sát ở cuối bài. Cái chủ đề lần này, chủ đề của bài tiếp theo đó sẽ là chủ đề về viêm tụy vào ngày 27 tháng 7. Thì rất là cảm ơn tất cả các anh chị vì đã dành thời gian tham dự với Royal Canin, và xin hẹn gặp lại các anh chị ở hội thảo lần sau. Em cảm ơn tất cả các anh chị. Cảm ơn tất cả, cảm ơn các anh chị, chúc anh chị một buổi tối vui vẻ.